The importance of safe nurse-patient ratios, just for quality patient care. Okay, so I found a study with the evidence-based practice centers, and it showed the relationship between adverse patient outcomes and hospital nursing staff. There was multiple studies. All of the 5 studies, they showed some association between lower nurse staffing levels and one or more types of adverse patient outcomes. With an increase in staff, you'll see a reduction or decrease in medical and medication errors, patient mortality, hospital readmissions, and length of stays, patient care costs through avoidance of unplanned readmissions, and of course there's fatigue, and that promotes nursing safety, nurse reduction, and job satisfaction. Higher rates of preventable events. Hospitals with lower nursing staff levels tend to have higher rates of poor patient outcomes, such as pneumonia, shock, cardiac arrest, urinary tract infections, healthcare associated infections, pressure ulcers, and falls. Just for example, pneumonia rates, they're sensitive to staffing ratios. There was another study that I found, adding like a half an hour of RN staffing per patient day could reduce pneumonia in a surgical patient by over 4%, which is a lot if you think about it. This was a chart that I did find. It shows the percentage reduction in rates of outcomes among medical patients in hospitals with high nurse staffing versus like low. So UTIs, upper GI bleeds, hospital-acquired pneumonia, shock, cardiac arrest with high RN staffing and high all other level staffing, it shows like a 4 to 12 or 4 to 25% increase. So the possible solutions for these possible problems. Hiring nurses, of course. I found a study that finds that an increased staffing of registered nurses does not significantly decrease the hospital's profit, even though it boosts the hospital's operating costs. It doesn't decrease the hospital's profit, even though it boosts its operating costs. A 1% increase in RN full-time equivalents increases operating expenses by about 0.25%, but results in no statistically significant effects on profit margins. Hiring new RNs will in turn reduce the cost by decreasing RN extra time and overtime, and it will also reduce the hospital's cost for PRN and float pool staff. Increased PRN and float pool staff will help decrease extra time and overtime, especially like on the unit I work on. If we hired more staff, or even like PRNs would work on it, we'd see like a decrease in extra time and overtime with that. Keeping consistent staffing on floors when one RN leaves, beginning interviewing replacements for that, and to interview them fast. I know like HR, like me and Jason have talked about it, HR works really slow. So it takes a while to get that replacement up on the floor. Cross-training ICU float pool staffs to cover med-surg floors in addition to ICUs. We've also talked about this, and like to put med-surg on ICUs would probably be a little difficult, but to like cross-train the ICU float pool staff and put them down in med-surg could probably be a possible solution. Retaining nurses is a big thing. Only 33.4% of nurses believe that there are enough staff to get the work done. Retaining nurses is a cost-saving measure. I read somewhere that it costs $65,000 to train a new nurse, and put them on the unit. As it reduces the amount of hospitals spend on recruiting and training new staff, offer incentives for working extra hours, talk to staff about concerns, changes, and what they'd like to see in the future of the hospital, kind of like get them in the mix and get their ideas flowing. Increase benefits to help retain staff, such as increased incentives for each additional year worked. So the state of California passed legislation to have a minimum nurse-patient ratio. Many other states have tried considering doing this. I know Ohio has, and they tried twice, and it's failed both times. Consider cutting spending for other non-licensed personnel to increase staffing for licensed personnel, and that would mean like cutting like the cleaning personnel or any of that to increase RN personnel. And then there's a future staffing issue. The government predicts that by 2020 there will be a 29% decrease of an increase in nursing vacancies. Retaining nurses is just another way of helping, asking nurses about their concerns, other incentives for training new staffs, and identifying causes of high staff turnover included directly from discussion to staff. And that's all I have. Any questions?